morning, it's Thursday. Today I believe you're going to be following me on my day. Of course, today I woke up silly early. I'm in general an early riser, usually 6-ish. Thursdays are early day starts for me, and then I have my first meeting at around 6 o'clock just because the guy that I meet, Dave Nickel, kind of a friend and mentor and veterinarian that just helped me talk through a lot of leadership things. He's in a different time zone, so it just works out for me to meet with him 6 o'clock Eastern. Some days I'm able to make the most of it and get some exercise in, so that's what we're gonna do today. Has everybody had breakfast? What's up, guys? Are you waiting for more food?
So this is Penny. She's a 3-year-old female spayed French Bulldog presenting for history of back pain, episodes of back pain. At the end of November, she started noticing slow ambulation, disinterest in using steps to get on furniture. By the 4th of December, she started noticing the inability to get comfortable, excessive shaking, panting, and difficulty posturing. She's a cool girl.
Okay. So 3-ish episodes?
3-ish episodes, correct.
A month and a half or so.
Yes. I asked them if they were ever able to fully keep her in a crate. They said no, because she's very crazy.
You're crazy. You're crazy. Penny, 3-year-old female spayed French Bulldog. 3 episodes of pain. It's not really clear. It's neck pain, back pain. It's just kind of difficulty getting comfortable, shaking, panting, just seeming uncomfortable. Improved on meds and rest, then relapsed, then improved, then relapsed. It doesn't sound like we're really resting. I guess mild scuffing of the right pelvic limb a couple days ago. So. Exam's completely normal today, so don't know. It's hard for me to say, yes, it's neuro, it's not neuro. If it's neuro, where in the nervous system it is. Being that we have had 3 episodes, that to me is a reason to work up, but they also aren't necessarily resting. So if it's a disc, in theory, it could still get better with enough time, rest, and medications. Just worry that it might not be a disc because we're a French Bulldog. Frenchies also get things like meningitis or inflammation of the coverings of the spinal cord itself. We can get other things, tumors even at a young age, infections, etc. So it is not wrong to work this pet up. If they say, hey, we want to give her more time, we'll just get really, really strict about the rest.
Whenever she releases her bowel, she gets crazy and she starts running back and forth. And I noticed when she stopped running, her right hind leg was trembling a little bit.
Okay.
But within a second or two, she just went, but since we knew that we were coming here, we've been watching her more closely.
Sure.
And I did notice that, and sometimes I notice that it's just the right hind leg. She leaves it a little bit further back, and she has bad posture. I don't know if that has anything.
I mean, it's just another piece of the puzzle that leans towards it being a back problem. It's not going to be enough for me to say, I know it's a slipped disc,
Right.
but it's just one more thing that leans towards my recommendation of looking for an underlying cause. When I say looking for an underlying cause, what do I mean? I mean doing tests. So an MRI is going to give me a picture of her spinal cord, and we'll probably start with her back. If there's something obvious, we won't necessarily look at her neck, but if I don't see an obvious slam dunk answer, just because her exam right now isn't telling me look at her neck versus look at her brain versus look at her back, we'll kind of go into it with an open mind of, we're looking at everything.
Definitely let's do the MRI.
Yep.
Definitely, I'm sure I know what route we're gonna take, but I need to call my husband and just us 3, talk about it. It's gonna be okay. It's gonna be okay.
Yeah.
We came to the best.
it's just like.
It's scary. No,
That's our baby. That is our life.
I
You have our life in your hands.
I get it. Sorry you guys are going through this.
No, I'm so happy we're here. And I told my mom this morning, I was like, I'm ready for the good, the bad, and the ugly. Yeah, it still hits, you know?
Yep.
So this is Zoe. She's a 12-year-old female spayed Maltipoo presenting for acute seizures. Her first seizure presented on the 17th of December and was characterized as whole body shaking and vocalization for approximately 2 minutes. Preictally, she was chewing on a very hard treat, and while she was chewing on it, she started twitching, and then she fell laterally recumbent into the seizure. Post-ictally, she was just laying down and tired for a few hours. Overall, ever since then, she's been very lethargic.
You got bad knees, kiddo. Okay, we
She
can
looks
turn her
good
back
for her
around.
age.
Yeah, no, she looks great for 12, huh? Hey. You good dog.
Just brought back full memories, Zoe.
Okay, she can go in her house. I'm just gonna check her records. 12-year-old, Maltipoo, first time seizures. Sounds like a seizure. I guess that's usually the first thing that I'm trying to sort out is it actually a seizure? We'll ask the owners a little bit more, but it sounded like a seizure as opposed to like syncope or pain. 3 main causes of seizures: things outside the brain, things inside the brain. Idiopathic epilepsy at 12 years of age. Idiopathic is much less likely. We've got normal blood work, so things outside of the brain are a little less likely. Still could be idiopathic, or what we call cryptogenic in a 12-year-old dog, but just because we're 12, late onset seizures with normal blood work, our concern is for something inside of the brain tumor, stroke. Those would be the 2 big ones in an older dog. Let's go talk, and we'll almost certainly recommend an MRI. If they elect not to do an MRI, being that it's only been 1 episode, we probably won't start medications at this point. Say just keep an eye on it if we have another seizure or if we start doing something strange, bumping into corners, or bumping into things, walking into corners, staring at things, stuff like that. Then we'll change our plan. Sound like a plan?
I gave her a treat, which was these dehydrated sweet potatoes, but they were so stiff. I realized that afterwards. I'm like this, and she started chewing on one, and she started having a hard time, and she started chewing, and then a seizure started. The first thing I did is I went into her throat to make sure she didn't,
Wasn't
because I
choking on
thought she was
something.
choking
Yep.
at first, and she was fine. I'm hoping it's a once-off for her.
Yep.
Obviously, I don't think we really need an MRI today.
Sure.
It's nothing like she didn't have repeated episodes.
So her exam's completely normal. I mean, she's alert, she walks normal. I mean, she's a little timid when she walks. In dogs, I sort of break seizures into 3 main things that can be the underlying cause. So the seizure is just a symptom. It doesn't tell us what the problem is. It just tells us that there's a problem affecting the brain. The third cause of seizures is what we call idiopathic, where there isn't a problem outside of the brain that we find on blood work, and there isn't a problem inside of the brain that we find on MRIs. And that's usually the best cause for dogs, but usually that comes on between 1 and 5, 1 and 6 years of age. So just the fact that she's 12 and the fact that we have normal blood work, even though it was just 1 episode, is why I'm recommending an MRI. But I totally get the flip side of that is, well, gosh, she's relatively normal now. It was just 1. So there are different approaches. Approach number 1 is that we do an MRI, because hopefully it's that she got into something, and that's out of her system, or this is idiopathic epilepsy and she's just 12 instead of 4 when it comes on. That would be the best thing for her. So the only way to prove that is by doing an MRI, because if it's a brain tumor, there are things that we can do to try and help there, versus a different approach for if there's a stroke, versus if it's completely normal. Again, best news possible, we're all happy, but we all sleep better at night knowing that there isn't something more worrisome that we could or should be doing something about at this point. Okie dokie, do you have any other questions for me?
No.
Alrighty, well, quite frankly,
I know what my options are. Thank you.
Yep. Hopefully this is the last time we see each other.
I hope so.
We'll call you. No offense at all. And I'm sincerely. So you'll get phone calls from us every so often, probably in a month or so, just to check in. 6 months,
Great.
maybe 3 months.
Thank you
Alrighty.
so much.
Very nice meeting you.
Very
All right.
nice meeting you.
We'll meet you up front. Hello, Luke. Are you a good dog? Are you a good dog? Huh? Are you a good dog? What are you doing with your tail there? You gonna come out? Let me pick you up. You're soft.
So Cutie began dragging his pelvic limbs yesterday morning.
Okay.
Mom says prior to that she didn't notice any lameness, any kyphotic posture, no low head carriage. He was running around just perfectly fine. She did say that when she does bring him outside, he's able to weakly stand on his pelvic limbs to defecate, but then he won't be able to hold himself up for too long. Today he went to Banfield. They didn't do any diagnostics. They just urgently referred to us, and he came directly to us.
Good job. Here, Owie. Hello, how are you? Dr. Wong, Michael, nice to meet you. Mike. He's never had any sort of back pain before or anything. Okay.
I know that Dachshunds have that, but he's so young.
Yeah. So, I mean, as you've alluded to, Dachshunds do get a back condition. So what can we say from his examination? He's having a neurological problem. So this isn't due to bad knees or a bad heart or anything like that. Specifically, it's his nervous system in his back. So his brain's completely fine. The spinal cord of his neck is completely fine. So the information from his head to his front legs, perfectly fine. But as it tries to make its way to his back legs, the information's getting cut off somewhere between his front legs and his back legs. He does have some movement, but it's very, very minimal. Dachshunds get slipped discs. What a slip disc is, his back is made up of multiple bones called vertebra, and it's they're stacked end to end to end, and in between each bone is a disc, what we call an intervertebral disc, and that it's kind of like a jelly donut shock absorber that gives mobility to the spine and cushioning to the spine. But what happens in small dogs, Dachshunds would be our #1 breed, French Bulldogs would be actually probably our #1 breed nowadays, but that jelly of the donut loses its squishy consistency, becomes more dry and brittle, and instead of having shock absorbing capacity, it leaves the donut and pinches on the spinal cord. And when the spinal cord is pinched, that information can't make it from the front legs, from the brain past the front legs down to the back legs. There are a handful of other things that it could be. Dogs get meningitis, they get tumors, they get infections, but Dachshund that was normal 48 hours ago and now can't walk is a slipped disc until proven otherwise. Strong recommendation for a young, otherwise healthy Dachshund that was normal 48 hours ago is to do an MRI to find out, is it a slipped disc versus one of these other things? And assuming it's a slipped disc, it'll tell me, is it this one, this one, this one, or this one? Is it more off to his left side than his right side? For surgical planning, because surgery would be the recommendation to remove that compression that's on the spinal cord.
I mean, what's the recovery for after surgery?
Most dogs stay with us, like I said, 4 or 5 days after surgery. That's kind of just, rest, relaxation after big surgery, making sure that he's improving. We do some physical therapy while he's here. We transition him from these strong injectable pain medications over onto oral pain medications. We make sure that he's peeing on his own. And then when he goes home, it's usually a 2-week crate rest period where he's in a cage, kind of 1.5 by 1.5 of these squares. He goes outside on a leash and harness to do his business. He might be walking by the time he goes home. He might not be, but every dog's different. He would be at a point that you could manage him at home. So that's option 1. That's my recommendation. Option 2 is that whether it's risks of anesthesia, whether it's costs associated with doing tests, we say we're not going to do an MRI, we're not going to do surgery. In that case, I would prescribe some medications. I would prescribe steroids. I would prescribe pain medications. And we'd say, okay, cage rest. We usually do that for a month of cage rest, then a month of, I can tell you're kind of decided on the other thing, but the point is other options exist.
Well, let's do.
Yep. I'll get a little bit of paperwork together. Do you have any questions?
No, just the likelihood of it happening again after surgery is all I want to ask.
Great question. So as a dachshund that, assuming this is a slip disc without surgery, we would say there's about a 50% chance of this happening again. With surgery, there's about a 10 to 15% chance of it happening again. So it doesn't go down to 0, but it's much better with surgery.
All right, doctor, well, let's
Okie
get
dokie.
my boy
Nope,
better,
that's the plan.
please.
I'll get some paperwork together.
Okay.
I'll be right back and we'll go over that. So give me 5 more minutes or so, okay?
Thank you. I
All right.
appreciate you.
Sorry, you guys are going through this.
Thank you so much.
All right. Talk to you.
Thanks.
So we MRI'd her back and, nothing dramatic there. Definitely no surgical slipped disc, no obvious, tumor, malformation, infection, etc. So then we went and we looked at her middle back, kind of from her shoulders to her waist. Same thing, completely normal. And then we looked at her neck. So we looked at her entire spinal cord and, all I see are 2 little tiny disc bulges in her back and 1 tiny disc bulge in her neck. Nothing that I would ever do surgery on. Good news, we ruled out things like tumors and infections. We went ahead and we did a spinal tap, and I'm gonna send that out to the lab, so I should get that result tomorrow. So this is Mr. Luke, MRI. I don't know, it's not super obvious on the sagittal, but on the transverse we can see it very nicely that we've got kind of this dark stuff on the right side of the spinal cord, outside of the spinal cord, overlying L76543, overlying L34. Just because he's a young dachshund, we're gonna do a longer incision so that I have access to all of the other discs in his back so I can fenestrate or do a preventative procedure to make this less likely that it happens to him in the future.